donations being given by individuals in churches. Everybody donates. The members who attend, the congregants, the guests, and the who, Honorable Manzo, and all these Waheshimiwas. If we speak the truth, because they are leaders and they're invited by the churches, they give their donations. I think let us separate other forms of harambes in other social spheres of life.
Yep.
That is what is governed by the law. And we are happy as a country. CDF came in to eliminate harambes for schools and other basic things, which has been done. But the churches was not guided, because once you walk into the premise of a church, it is your own personal conviction to decide what to give. And when you give, others cannot begin guessworking that this is stolen money, this is what. It's neither here nor there. And I'm sure Hon Manzo is talking seriously about... Is
it possible for people to steal and give to the church?
No, you can't steal and give to the church. Of course, that would be wrong. But then it is difficult for
us. So how do you make sure that doesn't happen, that public resources are not stolen to be given or to whitewash them in church?
Some. We do not have powers, and even you, capacity, to know the source of what somebody is giving in church. And when you walk into churches...
My question is, how do we control that you don't end up having people stealing public resources to give to the church?
How are you going to do that?
You have just told me that it's possible.
Infrastructure?
You said it's possible, right?
It is possible that churches can be used for that.
So how do you make sure that doesn't happen?
It is not possible to stop. It is not possible to stop. Let us not do a game in futility. In fact, we're engaging in what we call fishing expedition. The church is an open place, is an altar. People walk in. You give what you have. And others give generously. Of course, when you talk of the president, he's not beginning to give today. He's known to be a generous giver in terms of churches. He's known to be passionate in ensuring that programs of churches are completed. Even the Catholic donation that was given the other day in the Catholic Church somewhere in Nairobi, that money was never returned. And that was the request of the church.
What do you mean the money was never returned?
That project... Pardon?
What do you mean the money was never returned?
Of course, the money was never returned.
How do you know that?
It was used by the church. We know.
They announced.
We know. You go check. you go check. We know. And what the president gave last Sunday, because I know this is what is triggering the discussion.
Yeah.
It is the president as a person who attended that church. It is the president who interacted with the church leadership, the congregants, and I am sure several requests were placed before him. And as a leader, he provided a solution. One, by donating his personal 20 million. Personal. It's not public. Personal. And committed to mobilize friends to raise 100 million. You know, wherever you go, even David Ocheng, if you go to a project, you say, okay, this project is 10 million. I'm giving 3 million, but I'll talk to my friends and we'll be able to raise 7 million so that you're through with this program. It is problem solving as a leader. That doesn't stop. The rule on fundraising doesn't stop leaders from
how many churches do you have in the country? How many churches have needs?
Many. All the churches have needs.
But I thought...
all the churches have needs. They have budgets.
But who said as politicians we don't build the church? Who said that it's us who must build the church as politicians? Who said that?
And the donations being given, the donations made every day, either in terms of sadakas, in terms of tithes, and in terms of general donations, is what is used to run the church. That is the culture.
Some know you want to close this, but I know you want to close this, but later.
Appointed by both parties, but now details of the signatories have not been provided in the contract signed by the Ministry of Health. Mheshimiwa Sossion, what should we do with this information?
Yeah, and the bigger question is, what should we do with the auditor's report? Because the Auditor, Controller and Auditor General has prepared a report with respect to procurement of these particular services, pointing out matters that looks very grievous, but we have not gotten the response from the procuring entity and the user of this service and facility. It would be wrong for us, even in this show, to make an instant and quick conclusion. My belief is, if really we want to roll out UHC, let us be absolutely honest And a document like this one of Comptroller and Auditor General should be scrutinized. And who is supposed to scrutinize? The National Assembly. It has a responsibility to do that. They will be able to flag out all the issues. They will be able to put the ministry to account to explain and justify why they went the route of specially permitted procurement procedure, why Safaricom is the dominant controller of this program, and whether the taxpayers are putting in any money through the budget, which I understand they are not doing.
Yeah.
And Sam, I've worked in the healthcare space, representing teachers at NHIF as a vice chair of NHIF, and at a time when universal healthcare was being rolled out and it collapsed because of many things. And I took teachers out of NHIF to run their own insurance scheme, which of course had a lot of issues and a lot of politics like this one, because a lot of interest, but I stood firm. It is now working and teachers are being treated. The same case with UHC. It is going to have politics. It is going to attract challenges, but as clearly stated by Mheshimiwa here, it must work.
It must work.
And if there are dirty issues around it, if there are dirty issues around it,
Sossion,
that can be proved.
How serious is this report?
Well, we'll treat any report as serious as it is portrayed until it is approved by another counter report from the Ministry of Health. But I've seen the Ministry of Health. Yeah, of course.
What is the work of the Auditor General?
The work of the Auditor General is to give an audit report and supply to Parliament. And what is the work of Parliament? Oversight. What does Parliament do? You oversight the state departments of government.
So what information do you foresee from the Ministry of Health that would overturn what the auditor has found?
Yeah, the report from the Ministry of Health will just be about facts. If indeed the specially permitted procurement procedure was done procedurally and properly advised by the Attorney General, then it will cancel the conclusions of the Auditor General's report. I think what we need to do here is to be very open. Let us not look like we are defensive. Let us not look like we are also too offensive without allowing the ministry to account itself. Because to roll out UHC is not easy. Ghana rolled it out and it collapsed at some point because we didn't get things right. One thing I'm happy about what the National Assembly did was to come up with the Public Health, the Primary Health Care Act. And you know the Primary Health Care Act, as Mheshimiwa stated here, is fully funded by government. That you walk to a dispensary, you are treated. It is not paid by SHIV contribution. The members' contribution that's what I'm saying. Not paid.
That's what the law provides.
Yes, that is what the law provides. Like only 4 billion that is what law provides. That is what law provides.
Yeah.
And level 1, level 2, level 3. But when you get to level 4, then you have you also have the shift coming in, because from level 4 upwards up to level 6, those are areas of referral. So the Primary Health Care Act, which is fully funded by government, and if it is not being fully funded now, then there should be more enhanced funding. And that communication has not gone to the public. People believe that as a contributor, the share contributions will be used to finance the primary health care service, which is wrong. And when I checked the data, because I was keen in knowing the data, what has happened from October up to date?
Yeah.
The primary health care facilities and the act itself has expended at least 1.2 billion for 3 months. That is the month of October, November, December. And in the month of January, it is expending over 800 million. And it is being paid at the end of every month. And you see, when you are rolling out a program, you don't deploy everything all at once. You keep testing systems and improving. So according to me, I'm satisfied.
For 2 months,
yes,
you said 1.2 billion.
1.2, and it is yet to receive another. Yes, for the month of, not 2 months, 3 months. The month of October, November, December, 122 billion.
So
the month of January.
Sorry, Mheshimiwa.
The month of January.
That's an average of 400
yes.
million shillings
And
per
then
month.
in the month of January, because of increased activities at the primary healthcare facilities, it is now at 800 million. So it looks like it is growing. There are a lot of activities at the primary healthcare. In UHC, the primary healthcare is a port of entry to the entire process up to level 4, 5, and 6. And when activities are intensified and services rendered, then you will see the activities going up. So according to the data because data doesn't lie, this is now a total of 2 billion that has been expended at the primary healthcare facilities. Have Kenyans who have visited the primary healthcare facilities been treated? Yes. And which are the primary healthcare facilities? They are both health dispensaries for the public, the private, and faith-based facilities. That has been done. And then on the shift, the inpatient admission at level 4, 5, and 6, 16 billion has been spent. Meaning patients who have been admitted and treated have been covered by SHA. I'm talking about SHA. And emergency and critical illness, because this is evacuation, this is ICU, these are other.
How much?
Yes, about. I saw something like 400 million shillings. And you know the emergency ECIF is added on top. The first line.
By the way, Mheshimiwa,
first line.
Sorry, how do you know this?
I've asked these questions, and I'm asking questions that I've extracted, and this is data that I've gotten, and I'm free to talk about it, and you can cross-check. So when I look at the three health, the PHC has worked to the tune of 2B. The ECIF has worked to the tune of 400 million. And when I look at the program, the next phase from March, is that even the ICU, because currently SHIF is covering at 4,000 ICU. It is going to be enhanced to 28,000 with effect from March. I've asked about
effective March.
Yes,
when
effective March. Yeah?
When was that gazetted?
No, it's not a question. This is information, whether it's gazetted or not.
I'm asking, Mheshimiwa Sossion, it is important that because SHIF, SHA, they work for the public. It is important that information is available to them. So I'm asking, now that you know that it's effective March, when did this become public, and when was it gazetted? Because if you're to look at the tariffs and packages that are being implemented today, they were gazetted.
Now that brings me to what we call public communication. I said from the beginning, even the public have not understood that if they are getting to the primary healthcare facilities, they are not paying anything. It is not part of SHIF, but it is PHC, which is paid for by the state. And the delivery of UHC model here in Kenya is a mixed model, where the state is financing through budget.
You have not answered my question.
It relates to the Digital Health Act, which is domiciled within the State Department and not at SHA. That then, from my knowledge, is that there ought to be regulations to govern the whole of this process. And those regulations, which have to go through Parliament, will go through public participation and the public.
Sorry, regulations for what?
Yeah, to implement the Digital Health Act, and that is going to guide even this procurement system and this infrastructure that we are talking about. So I agree with Mheshimiwa here. Can we implement not just the law?
We bought something without regulations by the implementing agency?
Yes, the regulations have not been passed.
Is that a problem?
No, the regulations have not been passed. And
that's what I'm asking.
Yes.
The acts are in place, yes. But you went to the market, shopped for a system. The owner, which should be the Digital Health Authority, does not have the regulations
with the digital
procurement.
Yes, currently it doesn't have the regulations. And what I guess
is that in order? Can we do that procurement without the supporting regulations?
This is where Parliament comes in. It was not enough to have the acts in place, but ensure that the regulations are in place and this program is properly supervised. We are talking about dialysis patients who are being handled properly now with the advent of SHA.
That's all fine. I think you're talking about the procurement process.
The general success.
Yes.
But then it cannot be dogged by by simple issues like lack of regulations, like lack of disclosure, lack of public communication, lack of education, like Honorable Manzo lacks a lot of education.
You don't think that's important?
There are no regulations, admit.
So all should be put in place. The regulations, proper civic education, proper communication. Like if you look at SHIF, for example, we have enrolled 20 million contributors. We have enrolled 20 million contributors.
You're saying it is okay to implement the universal health coverage without the prerequisite regulations. So it is okay to do that?
No, according to me,
yeah.
if times could be turned back,
yeah.
then by 1st of October 2024, we should have had the regulations and the laws in place.
We have the regulations. We have the...
Yes. He's saying the regulations for digital
they are never brought to the
For
house.
the digital election. That is a fact that is there.
Yeah.
And that we cannot run away from that fact. And these are some of the things that Parliament and line ministries have to implement. Because, Sam, if we want to get out of this conversation so that this system works seamlessly, we must put all the regulations in place and operationalize the act properly, roll out civic education clearly. If Kenyans don't know that even at the primary healthcare facilities, they're supposed to be treated for free, then we're in problem. So
and that's what I'm asking you. So it
Yes.
is okay to do all that, and it's also okay to go ahead and spend 104 billion shillings of Kenyans' money.
104 billion shillings has not been spent because
No. You look at the commitments.
It has not been spent.
Sorry,
that is a fact.
Mheshimiwa Sossion. Okay, so what has been spent?
104 billion has not been spent. Even that 2.5% that has been talked about was just but a mere proposal. And all that
What do you
will
mean a
fall
proposal?
in place.
A contract is in place?
Yes. And all that will fall in place once the regulations are in place.
Mheshimiwa,
So I think in all this
place.
ecosystem.
Sorry, Mheshimiwa, are you aware there's a contract between the consortium led by Safaricom and the Ministry of Health?
And it is not even specific about 2.5%. It's not there.
The Auditor General is responding on the contract that she has
That is why, Sam, this report of the Auditor General that has come out must be subjected to parliamentary process.
Have you seen
and
the
those
contract?
facts will come out.
Mheshimiwa Sossion, have you seen the contract?
Show me the contract.
No, I'm asking you, have you seen it?
Show me the contract. I've seen
Sorry,
Yeah,
just
I've
answer
seen
the question. Have you seen the contract?
I have not seen.
The Auditor General says she
I've
has
seen the report
perused.
of the user. I've seen the report of the Auditor General. I've seen the response even of the
You
ministry.
doubt the Auditor General?
I doubt the Auditor General.
Why?
Quite a number of facts will not fall in place. I am sure once Parliament oversights this process and the ministry is given a chance, you are entertaining the report of the Auditor General. You are not entertaining the response from the ministry.
Where is
what
the
they have done.
response? Where is it?
Have you sought for it?
No. Surely. We can only deal with the facts
because we cannot give the country one side of information. And then magnify failure, where absolutely there's no failure.
Let's close this.
No, and that's a fact, Sam, because the truth will fall in place.
It's a fact.
I was making my final conclusion.
Sorry, you're out of time. You're using facts and truth in the same sentence. Okay. I don't know what that means.